Pallor. Pallor is paleness of skin and mucous membrane, either as a result of diminished circulating red blood cells or diminished blood supply. Pallor can be temporary or permanent. Causes of pallor include anemia, hemorrhagic, hemolytic, dyshemopoietic, deficiency of iron, folic acid or vitamin B12, aplastic anemia, systemic and infiltrative diseases, chronic infection, pregnancy, and malignancies. It is important to note that pallor and anemia are not interchangeable terms. There are many causes of pallor, and anemia is commonest of them. The causes of pallor without anemia include vasoconstriction due to various etiologies like shock, hypovolemic or cardiogenic, exposure to cold, fright, arterial occlusion, syncope and postural hypotension. Cutaneous causes include thick skin and nails, edema, edema-causing diseases, and myxedema. Sites where pallor can be detected are lower palpebral conjunctiva, tongue, soft palate, palm and nails, and other mucosal areas like oral, vaginal, or rectal mucosa. Examination for assessment must be done in broad daylight and not under artificial lights, in order to not miss the subtle changes. How to check for pallor in the lower palpebral conjunctiva? Examine in natural light. Request the patient to look upwards. Pull the lower eyelid down and compare the color of the anterior part of the palpebral conjunctiva, which is attached to the inner surface of the eyelid, with the posterior part, where it reflects off the sclera. There is usually a marked difference between the distinctly red anterior and pearly white posterior parts. If this difference is not clear, then pallor is present. To check for pallor in the oral mucosa, tongue and soft palate, ask the patient to open the mouth and protrude the tongue and observe the dorsal surface of tongue, followed by the soft palate. They may look visibly pale or severely pale. Ask the patient to hyperextend the fingers. Compare the color of palmar crease with that of the adjacent skin of the palm. Pallor is said to be present if both are of same color. Loss of the pigmentation of the palmar creases of the hands gives a clue that the hemoglobin may be less than 7 grams% in that patient. Press the nail and note the color of nail bed after releasing the digital pressure. The nail beds may be pale due to reasons other than anemia also. Grades of pallor. When there is pallor of conjunctiva or mucous membrane, it is graded as mild. Pallor is said to be moderate if conjunctiva or mucous membrane and skin are involved. Severe pallor refers to involvement of the conjunctiva, mucous membrane, skin and palmar creases. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.